I would begin by asking you, when was the last time that putting the government in control of something resulted in it costing less? I think the answer is, when you put the government in control of something, it doesn't cost less, it always costs more. The Democrats are proposing to put the government in control of health care. We believe that means it will cost more and ultimately lead to rationing. This bill puts people in charge of their own health care. Let me go through 5 key pieces. Number 1, first provision of the bill says, if you like what you have, you can keep it. That's because 83% of Americans currently like the health care they have. The important part of this provision is that most Americans right now get their health care from their employer. This empowers them to say, I want to keep my current health care, and I want to keep the exclusion from income taxes that makes that health care possible. If you like it, you can keep it. Second, it covers every single American and gives every American choice and coverage. What that means is that every American that does not have a health care plan, and every American that has a health care plan from their employer but does not like that plan, can go out and acquire their own health care plan on the same tax advantaged basis that employers get. What that means is that if you pay income taxes, you will be able to go out and buy a health care plan and get a direct offset from your income taxes. But more importantly, for the disadvantaged in America, for the poor, for those in need, it means you get a government stipend that will let you buy your own health care. So every American gets choice and coverage. Third, it provides pooling Americans and group plan choices for every American. Right now, you can only get into a plan, a group plan, where costs are restrained, if you have employer-provided coverage. If you do not have employer-provided coverage, you can't get a group plan. The only group you can join is your employer's group. This bill says, and by the way, what that means is if you don't have an employer-provided plan, you buy in what's called the individual market, which is phenomenally expensive. This bill says to all small employers and all individuals who aren't a part of a group plan already, they can join a new pooling mechanism. It says that groups like churches, alumni associations, trade associations, and other civic groups can sponsor a health care plan, and you could then pick, I want to take my employer's plan, or I want to take the plan offered by the University of Arizona Alumni Association. I want to take my employer's plan, or I want to take the plan offered by the Daughters of the American Revolution plan. I want to take my employer's plan, or I want to take the Kiwanis International or the Rotary International sponsored plan. So there are many more group plans for you to pick from, giving you much more choice. Fourth, pre-existing conditions are covered, and chronic conditions, chronic illnesses, are covered at affordable rates. That is done through both reinsurance pools and high-risk pools. No one in America who becomes sick should have their income threatened or lose the ability to acquire health care at a reasonable cost because they became sick or have a chronic condition. And so through high-risk pools and reinsurance mechanisms, those people will be able to go buy health care at a cost equal to what every other American buys. And that cost is borne by all Americans. Again, the mechanism for controlling cost in this bill is from the bottom up, not the top down. It creates patient choice. It does not expand the government.